there has been many historical factors that have impacted upon Indigenous Australians' health. These include colonisation, where according to Health Infonet, Indigenous Australians had better health compared to their European counterparts in 1781, 7 years before the official decision was made to colonise Australia. The colonisation of Australia was detrimental to Indigenous Australians, bringing an epidemic of diseases along with European settlers, including smallpox and influenza. Smallpox particularly caused havoc with a substantial amount of Indigenous losing their lives due to no immunity to the disease, as well as social disruption with members of the flock that hunted and gathered passed away. Social exclusion is another factor that has decreased Indigenous Australians' health and well-being, especially in regards to racism, which is associated with poor physical and mental health, as well as the undertaking of unhealthy behaviours like smoking and alcohol abuse. Another historical factor is the stolen generation. Not only does it affect past Indigenous health outcomes, but also present-day Indigenous people. Through the forced removal and institutionalisation, it has impacted transgenerational. According to the National Aboriginal Torres Strait Islander Social Survey 2008, adults aged 40 and over removed from their natural homes are 2 times more likely to have a mental illness or alcohol-related problem, as well as that it affected social and economical indicators including education, employment, and income. Their holistic approach on health, including law, language, and land, was tarnished, along with loss of pride and self-worth.
Health needs of Indigenous vary greatly compared to other Australians. Wellbeing for Aboriginal and Torres Strait Islander people incorporates broader issues of social justice, equity, and rights. The significance of culture to well-being and therefore good health is also demonstrated by using traditional knowledge and the practices of traditional healers, which are adapted by many people for complementary use with Western science in an integrated healthcare system. A focus on the patient journey, which meets the clinic healthcare needs as well as cultural and social needs of Aboriginal and Torres Strait Islander people and their families, will produce better health. Use of regional or place-based approaches can also contribute to efficient and sustainable service delivery, based on economies of scale and sustainable service populations. This approach recognises the urban, regional, rural and remote diversity of Australia, particularly in those regions where geography, language, culture and behaviour may present obstacles to the effective access and delivery of services. Health professionals need to take a more holistic view on health in regards to an Indigenous individual's life, land and environment, community and relationships. This is an important skill if a practitioner is wanting to meet Indigenous needs to the best of their ability, as there can be compelling implications if a simple biomedical approach is used when interacting with Indigenous. The National Aboriginal Torres Strait Islander Health Plan 2013 to 2023 also stated that a strengths-based approach is a great clinical skill to acquire as a health professional due to the fact that it complements and supports existing strengths of the Indigenous individuals rather than focusing solely on the problem or concern. As you can see, mortality rates of Indigenous Australians between 50 to 74 more than double non-Indigenous Australians in 2003 to 2007. There is also a high proportion of daily smokers at 45%. Although Indigenous report positive well-being in remote areas, nearly a third have reported a high level of psychological stress.
Indigenous Australians' experiences when using health services present disadvantages in various ways outside hospitals, in the management of complex conditions, and within the hospitals where evidence shows, for the same conditions, Indigenous patients receive notably less procedures than non-Indigenous Australians. Statistics collected by the National Aboriginal Torres Strait Islander Health Survey in 2004 and 5 revealed that a survey of around 10,000 Indigenous Australians of all ages, only 1 in 7 Australians, 15%, stated that they needed to visit a GP in the last year but never went. 8% needed medical attention from other types of health professionals but never went. 7% needed to go to the hospital and never went. And 21% needed dental treatment and never went. It is stated that health professionals lack understanding of Indigenous culture, concepts of their health, and history, which can be detrimental to the experiences of the Indigenous Australians when using healthcare services. The Indigenous community also face difficulties in communicating with service providers when utilizing health services. This, in return, affects treatment choices and outcomes. Around 11% of Indigenous adults reported that they had difficulty understanding or being understood by service providers.
The Australian Bureau of Statistics states that 1.9% of the Australian population is made up of Chinese immigrants, as over 400,000 Chinese people live in Australia. Many Chinese Australians, when ill or pregnant, depend heavily on health assistance from others rather than doctors. This is due to their need to follow traditional practices. It is shown that Chinese Australians emphasize health needs such as importance of family in liaising between health professionals and patients with illness such as cancer. Health needs of Chinese Australian patients diagnosed with cancer include their preference for a confident and clear diagnosis and treatment recommendation. Health needs of the Chinese community when visiting healthcare providers include having physical evidence of treatment such as prescriptions. It is shown that Chinese Australians prefer to be examined by doctors of the same gender, especially amongst the female Chinese Australian population. The Commonwealth Government on the health needs of Chinese Australians funded a 3-year research project. The research included needs such as prevention management of diabetes amongst the Chinese community. A project that is run to cater for the prevention and management of diabetes and other health conditions include the Chinese Australians Better Health Research Project. The project aims to improve the health of the Chinese community. The project consists of 4 stages, which includes a health needs assessment, diabetes prevention program, the detection and management of dyspepsia, and health promotion and education program. In Australia, Chinese Australians encounter fairly obvious experiences in regards to language barriers when attempting to access health services in Australia. It is claimed that 35% of the Chinese Australians are unable to speak English well. Research provided by the Queensland Government showed that Chinese Australians access health services include hospitals and general practitioners. However, the usage is low. Language barriers can make Chinese Australians have different views on utilising health services in Australia, thus making it difficult for them as their beliefs are different in comparison to Anglo-Celtic Australians. This is primarily due to Chinese upbringing and family values, especially among the elderly population. This in turn causes the Chinese community to not express their health needs willingly unless they are forced to do so. For example, in Australia, female Chinese immigrants' inability to follow traditional practices in regards to childbirth causes them to face difficulty in observing dietary and physical restrictions due to pregnancy and after childbirth. There is shown to be lots of support from extended family members and lack of cultural sensitivity. Maternal and childcare services often lead to frustration and anxiety. However, in a different scenario, 2 studies show that the staff of nursing homes in Sydney favoured Chinese patients because many of their illness behaviours were able to be accommodated comfortably by people with Anglo-Australian values compared with Greek and Italian patients. Chinese patients caused less tension at meals and when they were in pain.
There are vast differences and similarities between Indigenous Australians and Chinese Australians. However, they both experience lower standards of health inequities when compared to non-Indigenous Australians. Life expectancy for Indigenous Australians displays on average 69 for males and 73 for females. However, Chinese Australians experience an average of 81.7 years of life. In contrast, both Indigenous and Chinese Australians are less likely to have their first antenatal visits before 20 weeks gestation. This could result in corrective barriers experienced by both groups, including language, access to health services, and income, which can lead to lower usage of health services when compared to non-Indigenous Australians. Both Chinese and Indigenous Australians have significantly higher smoking rates than non-Indigenous, although Indigenous Australians are more likely to have a smoking-related cause of death from cardiovascular disease.
Aboriginal health means not just the physical well-being of an individual, but refers to the social, emotional, and cultural well-being of the whole community, in which each individual is able to achieve their full potential as a human being, thereby bringing about the total well-being of their community.
Considering the findings from this quote, the available readings, and the Australian Indigenous Health Infonet, we have established a holistic strategy that reinforces the Closing the Gap commitment. Distinctively, our strategy will focus on safe communities and developing an intervention plan around increasing holistic health within the Indigenous community through preventative approaches to violence, abuse, and neglect. This is due to the fact that, according to O'Donoghue, many Indigenous children are now growing up in communities where violence has become a normal and ordinary part of life. Our strategy also pays close attention to the following social determinants of community safety, lifestyle, focusing on alcohol use, social support, and education. Our strategy's focal point is to empower the people of the Darug Nation who still reside in the Blacktown local government area. It includes the following: dispersing groups of volunteer Indigenous elders into the local shopping centres and events, providing both guidance and sharing their connection with country through modern mediums. This method of observation works particularly well within New South Wales. This is because of the circle sentencing laws that exist, which allow Indigenous elders to hand out punishments tailor-made for individual Indigenous youth. There will also be 3 weekly workshops to the Darug people, focusing on educating them on their health, which will be delivered by their own in a way that does not in fact target the Indigenous, but instead builds them up through the offer of alcohol management classes, anger management classes, and victim support weekly. As you can see in the table on the screen, each step links clearly to either an Aboriginal and Torres Strait Islander key cornerstone, social determinants of health, as well as it also works in conjunction with Closing the Gap initiative, thus reducing implications and encouraging those of Aboriginal descent to retain skills from the workshops that are being offered, as well as accepting the informal assistance that the Indigenous elders are offering at street level. Although our strategy was designed for the Darug Nation due to its comprehensive nature, it can be altered so it's applicable to a specific culturally and linguistically diverse group of Chinese Australians in the following ways: providing workshops for Chinese Australians to access specific focuses each week, providing Chinese elders with a platform to connect with and work on differences with their youth. However, for the strategy to be truly applicable and useful for our culturally and linguistically diverse group, it is principal that we alter the following aspects. Focuses need to be more directed towards the social exclusion that Chinese Australians experience, and workshops also need to be refocused to tobacco control, as the rates of Chinese Australians participating in this act are significantly high. These changes are due to findings from Health, Government, Tobacco, and the changing face of Australia.